Environ Life Science Limited, partnering for life.
The friends, on a topic which is very close to my heart. In fact, the topic that I have taken today is the how to approach a diabetic patient in a rural setting, because we usually have the doctors, urban areas where all the facilities are there. Rural areas is very difficult to approach the patients. The first thing is that when we think about the diabetic patients, we have to know there are two types of patients, type 1 diabetes and type 2 diabetes, and how to discriminate between the type 1 diabetes and type 2 diabetes, especially in a rural setup. The features useful in discrimination of type 2 diabetes includes, in type 1 diabetes, it is usually younger age, diagnosis less than 35 years of age, and the lower BMI less than 25, unintentional weight loss, and then ketoacidosis, blood glucose level is more than 360 at presentation. The criteria for the diagnosis of diabetes: fasting blood sugar, if it is more than 126 milligram percent. What is fasting then? The fasting means the no calorie intake for at least 8 hours. Diabetes का symptoms होता है polyphagia, polydipsia, polyuria, that means more of वो सिम्टम्स वगैरह नहीं होने से कभी कभी पेशेंट आते हैं, एक्सट्रीमली टायर्डनेस होता है, कभी कभी वेट लॉस हो जाता है, वो वैसे पेशेंट भी आते हैं. सो दीज आर द फ्यू फैक्टर्स दैट दोज विल बी हैविंग नो सिम्टम्स, बट सर्टेन टेस्ट हैज टू बी डन. इफ देयर इज अ फर्स्ट डिग्री रिलेटिव ऑफ द डायबिटिक पेशेंट, इज दैट रिलेटिव फैमिली हिस्ट्री इज देयर, एंड अदर क्लिनिकल कंडीशंस एसोसिएटेड विद insulin resistance like severe obesity, acanthus nigricans, all these symptoms, signs will be there. Now, there are two types of diabetes, as I told you. It's the type 1 diabetes and management, and also the type 2 diabetes management. The access for the type 1 diabetes management is the problem. Accessing to the insulin is a must for all the type 1 diabetes. Access to the glucometer and self-monitoring of the blood glucose is necessary, whereas it's difficult to get it. The quality of the insulin also depends on the storage of the insulin, or the presence or absence of the refrigerator. And in the breaks in the treatment, the risk of the diabetic ketoacidosis is the challenges for the type 1 diabetes. But the complications and understanding of the need of the chronic therapy, that means once diagnosed, these are the few things that has to be dealt with and then to be known to the patients. The problem with insulin. But another challenge is the glycemic control remains fundamental in the type 2 diabetes management. Therefore, one has to target that achieving or maintaining the tight glycemic control is an essential principle in the management of diabetes to avoid related complications. These are a few things that one has to know. In some parts, the opportunity for early intensive intervention is often also limited in the rural areas. Type 2 diabetes patients is frequently recognized by the life-threatening complications which develop in the patients. So what are the factors that help to overcome these problems? These are the problems that we see, but we have to consider as to what are the factors which can help to overcome these problems and improve reliable supply of essential drugs through the close liaison with the local pharmacy. Use of glucose-lowering medication in the management of type 2 diabetes. Before that, lifestyle modification and then the diabetes self-management is a must. It is definitely concern for the people and those who are working, of course, in the urban areas. We have plenty of diabetologists or endocrinologists, but in rural areas, these are the challenges. But we need to make some groups as to how we can involve the volunteers, how we can involve the local available people, those who can treat the patients with type 2 diabetes. It is possible, despite the apparent low cost and more side effects, the slogans which was going on by the different pharmaceutical agents. But still, we can have this people with diabetes and can be treated with sulfonylureas and also metformins. The other therapies are also there, and nowadays most of the therapies like DPP-4 inhibitors or SGLT2 inhibitors are also available in much pocket-friendly to the patients, and they can be also so DPP-4 inhibitors, SGLT2 inhibitors were also available, and then the affordability and accessibility of the type 2 diabetes patients. Thank you very much for the patient hearing.